So I am solving the upper layer extremity questions. 36-year male fall on outstage hand, the exemption of tenderness, anatomical snub box. So always anatomical snub box, the lateral boundary. They ask the question, it is extensor pollicis longus. Then 26-year man present to emergency department with extensive bleeding from after sustaining glass injury, exemption 7 cm transverse laceration across anterior aspect of the elbow. On explaining cubital found brachial artery. MBBR median nerve is always medial and brachial artery has to be lateral. Then the next question is 80-year-old man dislocates his shoulder and got it reduced in the emergency department 3 weeks later, unable to initiate the abduction, which is the muscle. To initiate the abduction is supraspinatus. Then a 20-year man presents to emergency department stab injury to thenar. This is thenar is hypothenar, little finger thenar on the thumb. On examination found to 2 cm laceration, loss of sensation, thumb and index finger, and weakness of the thenar muscles. Which of the following structure is most likely to be injured? So the nerve injury to the thenar nerve with loss of sensation, it has to be median nerve below this, and let us see sensory motor branches, both the nerves of the median nerve has lost. If sensation is presumed, then it is a recurrent branch of the median nerve. In order to expose right axillary artery, transference made below the clavicle point, just lateral to the sternal angle of the clavicle. So its sternal angle, clavicle, delta pectoral groove, which are the structure following encountered in the dissection down to the vessel. Following structure should be encountered. Thoracoacromial artery is there. So this is the main thing. The next lateral thoracic phrenic and all these are very far away. A 4-year-old boy to the immensely painful right elbow. His father stated that he was swinging his son by the arm. An X-ray shows radial head is displaced from the annular. It is annular ligament. 26-year man in the emergency department after sustaining glass cut to the arm and external tension laceration on the anterior aspect of his arm. He has symptoms suggestive of ulnar injury. On exposing upper part of the arm, we would expect the ulnar nerve to be. Ulnar nerve should be medial to the ulnar artery, or whatever is there, medial to the brachial artery. Always medial. Whether it is ulnar artery or brachial artery, ulnar nerve never changes position, it's on the medial only. 90 presents with the emergency department profoundly hypovolemic, fallen from the horse posterior into chest fracture of the medial third of the clavicle that injures subclavian artery. Subclavian vein is prior if present. Actually, subclavian vein is immediately behind the clavicle, but it's not present here. So 20-year male is emergency department after accident tripping over the laceration glass bottle. On examination 2 cm laceration on the hypothenar. This is hypothenar with loss of flexion in the distal interphalangeal line, which is most likely tendon. Distal interphalangeal joint. So for example, profundus is supplying to the interflexion. After mastectomy, woman's winging of the skull, long thoracic nerve, thoracodorsal, this is latissimus dorsi, unable to push, and intercostal brachialis, loss of axillary sensation. 50-year-old alcoholic man present in image found to be unable to extend the wrist and thumb, wrist, thumb and fingers of his right hand. He found to have weak extension of the elbow. Elbow is also unable to extend elbow, extend this, and loss of sensation dorsum of the first wave. Which of the following nerve is most likely? Now, elbow extension is by the triceps. Which of the is supplied by the radial nerve, which is supplying to the first wave also. 36-year butcher in left index with a knife suffering a deep laceration on the palmar aspect of the thumb. He is unable to flex this thumb, which this flexor digitum thumb pollicis, flexor pollicis longus. 58-year man is due to have such a duplicitous contracture releasing little finger of the right hand. Which of the following anatomy of the ring finger is correct? Now duplicitous contracture is there, cutaneous innervation from the radial nerve. Yeah, it is having no cutaneous. It has cutaneous innervation from all the nerves. Ring finger is supplied from all the nerves. It is abducted by palmar. Palmar helps in paddies and dab. Abduction is by the dorsal. And flexor digitum profunda is also always inserted on the distal phalanx, not the middle phalanx. Patient presents to clinic following surgical procedure, complains she is unable to shrug the shoulder. This is trapezius or this by the accessory nerve. 33-year-old man sustained injury in the forearm and wrist. When examined in the clinic, he is unable to adduct the thumb. Adduction of the thumb is by the median ulnar nerve. Sorry. It's deep branch of ulnar nerve. Superficial and deep. Two branches are there. Superficial is for the cutinous and deep is which nerve supplied dorsal interossea of the fourth finger? Palmar and dorsal. Both the interossea are supplied by whether it is fourth, first, second. It's only for the lumbricals there is difference. This is ulnar, deep ulnar nerve only. 23-year-old patient was admitted after falling on oxygen. His examination revealed that he has lost sensation in the palmar aspect of the index and the middle finger, palmar, and is most accepted cause of injury. So median nerve sensation is lost. His examination revealed he has lost sensation over the palmar aspect of index and the middle, which is most accepted injury. So superficial branch of median nerve. Here is the dislocation. Medial nerve injury is there. So lunar dislocation. What is dermatome of the little finger? The little finger has got the C8 and the thumb has got C7. What is the relation of ulnar nerve to ulnar? It's always ulnar. Fromet sign is for the which of the following muscles? So it helps for adduction of the thumb, adductor pollicis. Positive approach to the humerus, most common nerve, humerus. Shoulder joint, posterior in the middle, suppose it is radial nerve. What is the dermatome give sensor supply to the deltoid muscle C5? It is the batch area. What is the root value responsible sensation of middle finger? So C7 and this is C8. Ulnar is C8 and C7 has to be middle finger. Head of the radius articulates with. So there is one, the humerus has got trochlea and the capitulum. What is nerve supply to the lateral side of forearm? C6 is supplying to lateral side musculocutaneous nerve. What is the course of median nerve related to brachial artery? Throughout the arm, patient suffered an injury from deltopectoral groove medially. Which structure? Cephalic deltopectoral groove medially. Cephalic vein is commonly injured. Not affected is. So all the others, cephalic vein, pectoralis major, thoracoacromial will be injured except joint capsule. Patient have upper limb injury during examination since the dorsal aspect of the medial was intact and prominent claw. So it is at the level of wrist, it will be prominent and partial will be elbow. Patient was undergoing radial head surgery for fracture, post-operative loss of extension, intact sensation. So extension is lost. The posterior, this is the motor, PIN most probably. Patient suffered a cut in front of the elbow, which is most lateral structure to be injured. In front of elbow joint. Lateral is the from medial flexor tendons, lateral MBBR. So radial nerve will be the in the biceps tendon. Median, brachial, ulnar, these are all. So anterior interosseous is not here. It is the branch of median. So biceps tendon is the most lateral. Ulnar is most medial, then brachial artery, then biceps tendon, then radial nerve. Patient has weakness of the elbow with loss of sensation of first dorsum digit. Again, which nerve is involved? Dorsum of the digit first is by the radial and elbow extension is by the triceps, the radial nerve. 32 years man suffered an injury to the palm resulting loss of sensation of hypothenareminous medial 1.5 fingers. Which nerve? This is ulnar nerve superficial branch. Arterial supply to the scaphoid enters from distal end. Patient has injury at the wrist. Upon examination, hand was placed on the table with palm. Patient can't make thumb. Which muscle is involved? Again, this is either adductor pollicis or opponent's pollicis. See the options: abductor, is adduction, abduction. Abductor, opponent's pollicis. This is the question. What is the dermatome supply of the elbow, lateral forearm and thumb? What is dermatome supply of elbow, lateral forearm and thumb? So it is C6, C7. C7 is not there, so C6. 32 years old patient presented with prominent claw. With loss of sensation of medial arm. What is spinal dermatome? Prominent claw. Again, it is loss of sensation of the medial arm. So median arm is T1 and prominent claw C8 T1. It has to be T1. Yes, ulnar arm T1 T2. Man suffered a cut injury above the olecranon process caused loss of ability to extend elbow. If sensation is intact, what structure is affected? Triceps tendon. Man suffered a deep injury near olecranon with no elbow or wrist extension. Here is the radial nerve. Patient was admitted immediately with a painful arc 60 to 160. Which of the following would be the causative pathology? So here is either trapezius muscle, that is a lifting up, but subapical bursitis or rotator shoulder cuff. So supratendinitis. 35-year-old patient has a wrist injury and developed thenar hypertrophy. So recurrent nerve of the median. Yes. What is spinal center of arm supination? Supination supplied by biceps, which is supplied by musculocutaneous, done by biceps, which is supplied by musculocutaneous. Musculocutaneous has got C. It is a lateral cord upper part C5-6. A patient can lift his thumb off the table while palm is facing downward. Can't lift. So this is the extension pollicis longus. So extension of the pollicis is done by radial nerve. So let's see, the branch is a posterior interosseous pin. Patient was undergoing surgical release of dupitans contracture at the ring finger. Why nerve is injured just lateral to the deep flexor tendons of the ring finger. Which nerve is affected? This is lateral to median nerve has to be there, and that too branch. 12-year-old was suffered supracondylar fracture. Which nerve is the greatest risk? Supracondylar fracture, median nerve or anterior interosseous nerve. A patient developed ptosis and loss of sensation over the medial side. Ptosis and loss of sensation medial side after shoulder injury. T1 is the cord. 24-year-old man suffered an injury to the upper limb. On examination, his ring and little fingers are partially flexed. Dorsal aspect of this finger, ring and little finger, this is lesion at the elbow joint. Ulnar injury at the elbow joint, at the forearm. Ulnar at the elbow, dorsal cutaneous not arise. So intact sensation. So this is ulnar at the forearm. Above the elbow, the nerve, dorsal cutaneous will be intact. So cutaneous nerve is intact. Surgeon made incision below the clavicle. Remember which of the following structure will not be encountered? Shoulder joint. Not as the root of brachial plexus. Arm injury, she is unable to catch the knife as it extends. The loss of sensation of the badge area. This is what is likely the cause. So, unable to catch the knife as her hand flexes. So, radial low. It is just like a upper cord palsy, posterior cord, radial nerve and axillary nerve both are involved in this. Numbness, dorsal wave of hand, which nerve is radial? Patient has developed weakness in the intrinsic muscle with loss of sensation of the inner aspect of arm. Intrinsic muscle, ulnar nerve. Lower cord of brachial plexus, Pankos tumor. "24-year-old suffered an injury to the ulnar nerve during the fight. Which of the following?" So this 50th question number, intrinsic muscles means ulnar has lost. Inner aspect means there are two, C8, T1. And if it is Pankos, lower, that will lose the sensation. Ulnar nerve doesn't have the supply to sensation. Medial cutaneous nerve of the arm. From the medial cord. 24-year-old man suffered an injury to ulnar nerve during the fight. Which of the following thumb movement will be ulnar nerve injured? So adductor pollicis. So adduction of the thumb, that is from its sign. Catch what is there. 24-year-old suffered an injury to the ulnar nerve during the fight. Again same adduction. 32-year man sustained an elbow trauma during his work. His examination revealed pain on extremes of pronation and supination. What is likely to the nerve injured? Elbow trauma, supination and pronation is pronatoris and supination. These helps by the biceps. Musculocutaneous, most commonly, let us see, posterior interosseous nerve is the patient present with the crutch-related axilla. He has numbness over the lateral aspect of the arm. Which muscle will be affected? So this is deltoid muscle will be affected. Okay. Lateral, which muscle? Brachialis, deltoid is not there. Nerve injury following shoulder. Deltoid is affected. Which other muscle will be affected? Shoulder dislocation, deltoid, so axillary, teres major, teres minor. Yes, teres minor. Which is the relation of extensor? What is the relation of extensor indicis to extensor digitorum? So, extensor digitorum and extensor indicis. Digitorum is lateral or medial. So digitorum is medial and indicis. What is the relation of extensor indicis? Yes, it is medial, then it goes to lateral. Digitorum, this goes crisscross. 12-year child with a trauma to his wrist, X-ray is normal and he was discharged. He is now presenting back 1 week with severe pain and anatomies of box scaphoid. Patient suffered loss of sensation of the palmar lateral aspect of the ring. This is the ring finger, palmar, and that too lateral. Median nerve area, dorsal is radial nerve area. Patient cannot hold a piece of paper with a thumb and index divided for deformity result injury. Which nerve? This is again ulnar nerve. deep ulnar. 25-year rugby player fracture medial epicondyle during the game. Which of the following muscle will not be affected? So all the flexor origin, flexor superficial flexor muscles are from, and whatever flexor digitum profundus, flexor palmaris, abductor pollicis, pronator teres. It is very low. The muscle they hard. That's why medial to introstion. Why not? Medial epicondyle. So you are thinking of nerve injury, erector pollicis, flexor carpi ulnaris, even flexor digitum. All these are supplied by the ulnar nerve, except pronator teres. It's not supplied by ulnar nerve. Following thoracotomy, patient complains of numbness and loss of fine control of the left hand. On examination, that numbness is in the ulnar border of relative both having the hand is weak, including both abductor pollicis brevis. First dorsal inertia. Which of the following is most likely neurological injury? So lower cord, lower trunk of places. 21-year-old patient was stabbed in the upper forearm. On examination, while his palm is on the table, he can't lift the thumb of the table. On examination of proximal filings of the thumb, patient cannot still fully move the interphalangeal joint. What is accepted cause? So he cannot move the interphalangeal. So OK sign is lost because of nerve anteradial. No? (26-year-old sustained upper limb trauma resulting communal proximal forearm fracture. On examination, he can't flex the elbow, and there is altered sensation in lateral aspect of the arm. Lateral aspect of the arm and flexion of the elbow. Flexion is done by this bicep brachialis, brachioradialis, and all these muscles, and sensation. Which nerve roots? So again, C5-6 musculocutaneous nerves are arising. C6. So lateral skin supply, lateral forearm is C6. 29-year-old fell from his bike. He is fully conscious and alert, but this appears to be remarkable increasing pain. He can't flex the elbow. With altered sensation lateral, same question I think. 26, sustained upper limb trauma. Fully alert, appears to be remarkable increasing pain. Examination, he can't flex the elbow with altered sensation lateral arm. What is most likely diagnosis? Now this is injury to the brachial plexus. Yes. A 12-year child suffered a glass injury proximal to distal palmar crease. On examination, there is loss of proximal joint flexion of thumb, which is expected associated lesion. Now there is some flexion of the thumb. So flexion of the thumb means flexor pollicis longus. This muscle. Let's see the option. Sensation. What is associated lesion? Loss of sensation, palmar thumb and lateral two fingers. 22-year-old presented with laceration over volar aspect of the wrist. What he is scheduled for exploration of the wound. What is likely relation of ulnar artery to his medial? Ulnar artery at the wrist. Artery, ulnar nerve is always medial to artery. 46-year-old presented with the paresthesia on the medial side of the arm. His investigation in presence of Pancoast tumor. What is expected nerve root compression? It is a lower C8 T1. Medial aspect of the arm is T1. 52-year female is posted to a clinic for complaints of weak right hand grip, as she cannot lift her suitcase, but she can write by thumb and index. So this is what is what is expected injury? She can't. She complains of weak hand grip. She cannot lift the shoulders. She can't write by the thumb and index. What is expected injury? So the person is intact posterior cord, hand grip, flexion, median, radial cause extension. So posterior cord injury. 23-year-old male presented with surgical procedure down in the picture, shown in the picture. So this is a procedure, he has got cut, and then thinner muscle wasting is there. What is most expected cost of presentation? This is proximal to what is structure forms the lower border of quadrangular post scapular space. Quadrangular, lower, teres major. 62-year patient old presented with lateral forearm sensation loss. Lateral forearm, which muscle action is expected? Lateral forearm is supplied by musculocutaneous, which is brachioradialis, all this forearm supination, biceps. 72 hours suffering on examination. He has tenderness or anatomical scaphoid on fracture. Regarding anatomy, he gets avascular proximal has got. What is contact type of? What is exact type of first carpometacarpal joint? It is saddle. Patient sustained motorbike marathon. Which of the following indicate proximal lesion with poorest prognosis? Erb's palsy has got poor prognosis. 33-year-old athlete sustained a stab injury causing laceration lower flexor presented with paresthesia over the lateral palmar 3.5 fingers. So this is median nerve, recurrent median nerve. So motor as a restricted thumb movement with weak wrist flexion and abduction. So here you have to add flexor carpi radialis tendon, median nerve and flexor carpi radialis. It is laterally abduction. 32-year man sustained upper limb trauma. On examination, he has mild claw hand. Of the little and ring finger with loss of sensation over medial 1/3 of the palm. 32-year man sustained an upper limb trauma. He has mild claw of little and ring finger with loss of sensation over. Mild claw means proximal at the elbow. Which of the following muscle components of the rotator cuff? Supraspinatus, infraspinatus, subscapularis, teres minor. 32-year man is sustained upper limb trauma. On examination, he is lost the medial sensation at the forearm. Which of the following most likely responsible? Forearm, lost medial sensation forearm. Which of the most likely sustained upper limb trauma? In trauma of the upper limb, he has lost a medial sensation at the forearm. C8. T1. 21-year-old sustained a radial fracture during the fight. On examination while palm is on the table. He can't. Palm is on the table. Palm on the lift from extensor. Proximal phalange thumb. Patient cannot fully move his interphalangeal joint. What is accepted cause? Tendon injury. 32-year man present upon examination unable to internally rotate abdomen. Unable to internally rotate, adduct, internally rotate and adduction. While rotator cuff muscle is responsible for internal. Which rotator for internal rotation? Subscapularis. 43-year-old patient presented with positive tinel sign reported to have hand pain at the night. Which muscle is expected to be preserved? Adductor pollicis. Okay, adductor pollicis is not given. So third and fourth lumbrical, they are supplied by radial. The surgeon need to perform mid-shaft fracture fixation while he found a nerve passing posterior then lateral to humerus. The nerve passes anterior lateral. What is expected? What is expected? Describe now radial. Which tendon lies in the third compartment of extensor retinaculum? So it is the first, second, third. This is the snub box extensor pollicis. The first is medial lateral border of the stump box, abductor pollicis brevis and extensor pollicis brevis. These are the two. B and C are the two. Then whatever passing radialis and all this in between second compartment. Then extensor digiti minimi and extensor in the this extensor digitorum, extensor indicis. Fourth, fifth extensor digiti minimi and sixth is extensor carpi ulnaris. 43-year-old sportsman is brought by ambulance post-traumatic. On examination, his vital signs are normal while he cannot abduct his shoulder. Sensory testing denotes paralysis of the lateral aspect of the arm and forearm. What nerve is so? Delta is lost. Posterior cord total axillary nerve is lost. Vital signs are now he cannot abduct the shoulder. Axillary, posterior cord, upper trunk of brachial plexus. Two-year child is assessed for lung surgery. His sensation is he is unable to push himself for crawling to standing position due to right arm weakness. So this is loss of latissimus dorsi or accessory nerve. Which of the following should be injured? Oh, it's not. It's a medial pectoral. These are the tendons. One extensor traversing the wrist joint. First, 3 is the extensor pollicis longus, and 1 and 2 abductor pollicis longus, extensor pollicis brevis. Then extensor carpi radialis, extensor longus and longus brevis, radialis and brevis. These two are passing in between. Then fourth is extensor. What is that fourth number? Fourth compartment, tendon sheath of extensor digitorum, extensor indicis. This is tendon sheath. Fifth is extensor digiti minimi, and sixth is extensor carpi ulnaris. Extensor carpi radialis and longus, they are in between. And first is abductor pollicis longus and extensor EPB.